Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural damage report, and a success story to send us into the week. The most urgent. Last week, the Health and Human Services Secretary, Robert F. Kennedy Jr., and CMS Administrator, Dr. Oz, received a letter from 2 Democratic senators calling attention to the effect of Medicaid cuts on cybersecurity and healthcare providers. Senator Ron Wyden and Senator Mark Warner made an effort to boost healthcare cybersecurity last year with the Health Infrastructure Security and Accountability Act. And now they claim what's being referred to as Trump Care would put small and rural hospitals at risk for cyber attacks because the cuts will damage security measures across the national rural healthcare system. According to the FBI, healthcare is the #1 target of ransomware attacks. Protecting patient health information is always a top priority for a hospital IT team, but effective cybersecurity requires financial investments that rural hospitals won't have the resources to make. Hospitals already struggling to keep their doors open for their community could become bigger targets for cyber attacks when their security can't receive the proper funding, putting patients, communities, and healthcare providers at greater risk than ever before. The Congressional Budget Office recently published a report that shows the One Big Beautiful Bill will increase the federal budget deficit to $3.4 trillion between now and the year 2034. Despite the estimated $1.1 trillion decrease in federal spending the bill requires, the revenues are projected to decrease by $4.5 trillion. While this may sound like bad news, rural health advocates hope it will strengthen their case to lawmakers to step in and prevent the new law from going into effect unchecked. The CBO also estimated that 10 million people will lose insurance coverage by 2034 because of this dangerous legislation. In other news, CMS is planning to replace its 300 eliminated positions with 100 new hires as part of the Department of Government Efficiency, an initiative to reduce its headcount by 20,000 full-time staff members. Washington, D.C.'s Children's National Hospital just cut 70 non-clinical jobs to save cost, and Care Oregon laid off 80 employees for the same reason this month. These are just small examples of what's happening in the healthcare sector across this country, adding up to the tens of thousands of eliminated clinical and non-clinical jobs. Cuts like these are building momentum as more and more healthcare providers struggle to manage the rising cost of labor. The economic impact on communities will be long-term and detrimental. With Medicaid cuts looming ahead, the Commonwealth Fund estimates 1.2 million jobs will be eliminated over the next few years. Today's success story is about an effort to save rural healthcare amid the mounting challenges and unprecedented funding cuts. A cross-party group of senators introduced a bipartisan act called Improving Care in Rural American Reauthorization Act, sponsored by U.S. Representative Buddy Carter. The act includes 3 programs: healthcare services outreach grants, rural health network development grants, and small healthcare provider quality improvement grants to support healthcare for patients in rural communities. While this is just a start to help the rural health we need in the coming years, the support from a bipartisan act like this encourages rural hospitals to keep fighting for our industry and, most importantly, our patients. Thank you to our sources for this episode: Becker's Hospital Review, Epstein Becker Green's Health Law Advisor, the U.S. Senate Committee on Finance, Modern Healthcare, the Congressional Budget Office, the Commonwealth Fund, and Rocktown Now and Congress Gov.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.